this difficult moment. We know that there's some segments of our population where the anger and the violence has been increasing. The healthcare is an area where we have seen an uptick in the last many years. We know that the healthcare workers and healthcare systems have not been immune to some of the violence, and if you listen to some of the healthcare workers that the Public Health Committee listened to during this previous session, we have heard clearly from them that they have been kicked, hurt, punched, spit on, and all sorts of threats, physical threats that they have all experienced. And this is the reality for individuals every single day in healthcare systems. According to the survey, the 2023 Violence Study of Healthcare Workers and Systems Survey, a quarter of all healthcare workers have considered leaving their profession because of the workplace violence. And the violence has been steadily increasing in this capacity according to the U.S. Bureaus of Labor Statistics. So it's important for us to come together and have an important conversation because we know why we are here. We have lost part of our family. We have lost an individual who was going to take care of somebody's health and somebody's well-being. Healthcare workers are trained to care for somebody else before they care for themselves. Healthcare workers have it in their reflexes to protect somebody else before they would protect themselves. You know how you hear about somebody putting your oxygen on yourself and then put it on somebody else? Healthcare workers, we are put into the mindset that you take care of everybody before you take care of yourself. And what we are seeing is something that the state will have to be the one to help out all of our healthcare workers. And the Public Health Committee passed this year Senate Bill 6741, which is now Special Act 2329. This law will be enacted on the 1st of January 2024. This is going to require the Department of Public Health to have a campaign to have public service announcements on a regular basis about mistreatment of healthcare providers and encourage public civility in healthcare settings. The Department of Public Health will also place on their website, social media, and other means to communicate about the importance of protecting the healthcare workers, and this is going to be through various means, including social media and television. The law also establishes the OPM, the Office of Policy Management, to have grants for hospital security grant program to make sure that the healthcare facilities are going to be safe and protected as well. And this is one of the works that we have done as a Public Health Committee. But one part that we have to do is to take care of another area where people work, and that is in the homes of our community members. For various nurses, healthcare workers, the homes are the workplace. For a patient, that is their home, but for us and people who are providing them care, this is actually their workplace. And that workplace is not being safe, and I will share some of the data with you, which is sad. This is national data that shows that 18 to 65% of healthcare workers experience verbal abuse from patients in their homes. About 41% of healthcare workers have reported sexual harassment. These are nurses and staff that are going to personal care attendants, physical therapists, rehabilitation that people are getting in their homes. They are receiving, some of the 41% of them have experienced this. About 2.5 to 44% of the home healthcare workers have reported being physically assaulted. So while we are here for the sad incident, unfortunately, this was a matter of time it was going to happen. In one study, actually there's study after study. I can go on for studies about how people and their environment are feeling threatened. This is also a moment where in healthcare we are seeing more and more individuals get their healthcare in their homes because we feel that the care that the people get in the hospitals need to get rehabilitation right away and then be in their home environment because that is supposed to be the best place for people to recover. Now, as people recover in their home environment, we will have to increase the workforce in that home environment. This will be one of the fastest growing segments of healthcare, but how can we, as a state, how can we as public health committee and others will be able to share with the next generation of the workforce to make this their profession when we cannot promise them security. So if anybody has any doubt, if you see behind me, this is our state coming together as one single voice. And we are saying that there's going to be zero tolerance. We will make sure that everyone in our state who is going to provide care at any level should be protected. I'm just going to suggest a few of the thoughts, and we will expand on this as this conversation goes on. The conversation is going to be, we need multi-pronged approach to be able to assess this. Anybody who is going to provide care in home environment, there needs to be protocols in place. The protocol for the lone worker needs to be there to make sure that that person has a safety check in advance. They need to have a risk stratification for the individual and also for the neighborhood. And depending on the neighborhood, should that person go alone, that would be decided by safety committees. And that person should have protection and escort if there is a risk and concern. Those protocols should be there in advance and have been there in the past as well, but we will have to have a conversation why we should not have them going forward. Number two, we need to, as an organization, have to have a post-assessment risk stratification, because sometimes you know the risk in advance, but sometimes you get the risk as soon as you're in that environment, so that needs to be in place, and the safety committees would come into action at that time as well. Number three, we need to have healthcare workers be trained from that perspective. Remember my comment that we try to put the oxygen on somebody else before we put it on ourselves? We will have to make sure that the healthcare workers are going to be trained, especially in home environment, to protect themselves, look at the risks for themselves in advance, and identify some behaviors and potentials that may be there. So that's the fourth, and the fourth important part is we need a payment reform, because this is not a sustainable model if we actually have the agencies continue to have more individuals working on this without the support. So I wanted to touch on these topics. We have some partners, people, friends who are here today. But I wanted to first start with my co-chair of the Public Health Committee, Representative Kristen McCarthy-Vahey. Representative Kristen McCarthy-Vahey, you're on. Thank you.
Thank you. Thank you, Senator Anwar, and thank you to every person who is standing here together in solidarity. And I appreciate you, Senator, outlining some of the things that we need to do. I also want to just acknowledge the grief, the loss, and the fear that our workforce feels. And this workforce is primarily women and women of color. And these are the people who are out on the front lines, supporting us, caring for us. It's a privilege and an honor to stand here together with my colleagues and to work with Senator Anwar and Senator Marks, who knows this work so well, and you're going to hear from her and what this means to her and all of her fellow caregivers who are out in the homes. So we stand in solidarity. We look forward to working together strongly to make sure that we are helping our helpers to be safe so that they can keep us healthy, safe, and strong. Thank you.
Thank you. Thank you. Next is Senator Marks. Senator Marks is a nurse, a proud nurse who has been an advocate on this issue and a home care nurse as well. So Senator Marks.
Hi, everybody. Thanks for being here, and to all my colleagues behind me. I can't tell you how it makes me feel. When I heard about this nurse, I actually got lots of text messages 2 days ago, and my phone obviously has been blowing up. I am a visiting nurse. I'm also the union president of AFT Local 5119, the VNA of Southeastern Connecticut, RNs and home health aides. And we have been trying to get safer protocols in our homes for decades. I think I've done it for 20 years. You know, for a little while, something bad will happen and things will get a little bit better. And then you get a new president, and then you get a new electronic medical records, and then COVID comes, and then all of a sudden the safety of the staff is not the #1 thing anymore. Actually, making money is always the #1 thing, but it's not the safety of the staff. And we need to remember to always make sure that it's the safety of the staff and the safety of our patients. And when I say the staff, it's not just the visiting nurses, it's the social workers, the therapists. And I think some of the most vulnerable people out there are the private care workers, the aides and attendants who are staying with our seniors who are aging at home, mostly women of color, many of them English is their second language, and they are all alone in these homes, sometimes for months at a time. And I'm not kidding you when I say that. No supervision, nobody coming to see them. And if they are assaulted or sexually abused by a client or by a family member, who do you think they go to? They don't go to anybody. They need this job. So we have a lot to do. Senator Anwar, talking about the data when he said how many nurses or healthcare professionals say that they had been assaulted, that number is way lower than what it really is, because we don't have to report it. We have to report every time somebody falls, or if we fall. Like, falling is this like unbelievably reportable thing that everybody loves to have stats on it. We need to be able to go back to the office and say, this patient spit on me. This patient watched pornography during the visit, and I'm not kidding, it happens a lot. And this patient hit me, or this patient was great, but all of a sudden the son is visiting who is very rude. There's drug paraphernalia in the home. We don't have anywhere to report that, and we need to make sure that we keep this data so we know how unsafe the staff is out there. So when I heard about the death, the murder, horrific, of this visiting nurse, she's my age, it was the easy job. I mean, I know the jobs in nursing and the med admit visits are the easy jobs. You're not backbreaking jobs. And that she went to work and she died. You shouldn't go to work to die. But that's exactly what happened to this woman and this family. And it's her family that wanted to have that safety check, right? The family that wanted the wellness check. This has happened to some of our staff before, where they haven't returned a text to their kids or something, and then the family member will look and see where they are. It actually happened to one of the workers at where I work. And they happened to know a firefighter in the town, and they sent the firefighter to kind of do a well check, and everybody was okay. She got written up. And it's still in her file. And this is a woman that never had anything bad happen to her. So she had a much better outcome than this woman in Willimantic, the nurse. So we also have to make sure that we have safety teaching, that it's not geared towards the hospital, which is what we get. I watch the safety video all the time, and there's a couple good things, like if somebody's escalating, offer them water. You're in somebody's house, sometimes in a bedroom, and you're not going to run to their kitchen and get water. So we need to make sure that it's about what happens when in the home care situation. I'm sure it's out there, and we have to make sure we use that. And I think that every assessment, the initial assessment, 2 people need to go. If you're in birth to 3, they always send out 2 people, many different people that go to the homes. So we need to make sure that in home care as well, 2 people are going into the home. We will pass legislation, and we will always have this visiting nurse in our heart. We will never forget her name, every single visiting nurse. We're all really sad. None of us are surprised. I want everybody to realize that. None of us are surprised, and every single one of us could tell you like 5 different stories where at the end of the day, we were like, holy cow. And you're probably wondering, like, did she know she was going into a halfway house? Well, I go into lots of sober homes. There is a house in one of the towns that I am a visiting nurse that is all sex offenders. I didn't know that when I had a patient in that house. I found out when I was doing the assessment, and I asked him, do you have family? Like, why are you living here? Do you have family that helps you? And he told me what he had done. And then I went back to see him many times, and I was like, Martha, you are nuts. Like you shouldn't be walking in here by yourself. But we don't take care of ourselves. We take care of everybody else. And I would sit in my car and I would check my biases, and I would say, they are a person. They're just like everybody else. They deserve to be treated just like if I was taking care of Lieutenant Governor Bysowitz in her house. Like, we go through this in our, like, they've had trauma. Who knows what happened to them? And you take a deep breath and you're like, I'm going to make sure they get the same care as everybody else. And that's what we do. So the last thing I just want to say is, when this is all over, we want to take care of everybody. So I don't want it to be that we don't want to go into the homes that are sometimes unsafe or a little scary. We do want to go into those homes, and we do want to take care of those people. We just need to make sure that we're safe and that our patients are safe. So I thank you for this time. You know, I knew being a nurse, I was going to make a difference up in Hartford. I couldn't quite articulate how when I was running. I'm really sad that this is why I'm gonna really make a difference this year as a nurse. But I am really glad that I'm here and I'm gonna do it. Thank you.
Next speaker is the President of our Senate, Senator Looney, who's been a champion to make sure people are protected, and he was very helpful in the bill that we had passed earlier. Senator.
Thank you, Senator. Thank you, Senator Anwar, and I think this is a timely day to have this. Unfortunately, we have this terrible tragedy, but as Senator Anwar pointed out in his opening remarks, and he's very expert on this, as of course is Senator Marks from her own experience, this is going to be the security and safety of people who provide care in homes is going to be an increasing problem because, as we know, hospital stays are getting shorter, except for those who have very serious illnesses. More people are being released early in need of significant additional care after they leave the hospital. That's being provided by home health care workers. We also know that there are many patients who are being cared for in hospice care at home. In some cases, as in my mother's case, for a number of weeks or a significant period of time before she went into the hospice facility for the last 2 weeks of her life. That is a growing trend. More and more care, more and more people are involved in needing that care and in providing that care. So we have to work on issues, as the Senator pointed out, that we have some legislation going into effect, and I know that the Public Health Committee will develop more in the next year, because we have to look at the consequences of growing trends. And as we said, the consequences are, or the trends are, that more and more care is going to be provided in a home setting, which is generally a good thing. People want to be in their homes. They tend to thrive more in their homes. Many people tend to decline more quickly in an institutional setting. But if that is true, we need to make sure that the people who are providing that care are safe and not having to have a sense of dread every time they approach a door, not knowing what's behind that door. So again, I want to thank everyone for is here today, Senator Anwar and Senator Marks for their leadership on this issue, and we will be looking for proposed legislation to provide that care, because it's on us to do that, because we are in many ways setting up structures to incentivize the home care, but yet we need to provide security for that home care. Thank you.
Thank you, Senator Looney. Next is our Lieutenant Governor, Susan Bycevics, who is also a champion on this issue. Lieutenant Governor, please.
Thank you so much, Senator. Our state has just had a terrible wake-up call. It's a wake-up call to make sure that we protect our healthcare workers, our nurses, our home health aides. And there are thousands of them, thousands. And to give you a sense of what a fast-growing this field this is, in 2011, we had 21,000 home health care workers. In 2021, we had nearly 40,000 of them. And they are women and women of color, by and large. We also have nearly 10,000 visiting nurses. Almost all of them are women. And every day when they go into a home to do their job, they're putting their personal safety on the line. We already have a whole host of regulations to keep people safe when they're in the hospital, but it's a wild west when home health care workers and nurses are going into their patients' homes to give them care. So I wanted to be here to stand in solidarity with colleagues from both sides of the aisle, and in particular my friend Senator Marks, who has been talking about safety issues for decades, especially for her colleagues who are nurses. And I am here to say that our administration is going to work with our legislative partners to make sure that our healthcare heroes, our women that do this very important work, will be protected. We need safety regulations, whether it's escorts or even just sharing information about a person's background, because often people's criminal background is evident in their hospital records, but home health care workers or nurses may not have access to that information. This is not hard, but we need to do everything in our power to keep our healthcare heroes safe. And on behalf of the governor and I also want to say that we are just devastated by the loss of Joyce Grayson. She was a hero not just because she was a visiting nurse, but because she was a foster parent for nearly 35 children, ranging from babies to teenagers, who she took into her home and cared for. Some of these children had very complex medical needs, and she was recognized in 2017 as Foster Parent of the Year by the Department of Children and Families. So here was a woman who lived an amazingly inspirational and impactful life, only to be murdered when she went to work one morning and never came home. And this is unacceptable, and the governor and I are going to do everything we can to make sure that we keep our healthcare workers safe. Thank you so much.
Thank you. Next, I wanted to invite Representative Nicole Claridis-Dietra, who is the ranking member of the Public Health Committee, House ranking member. And this is a bipartisan issue. We are all in this together.
Thank you. Thank you, Senator. Thank you, everybody, for being here today. As you've heard over and over again, this is a heartbreaking tragedy. And I offer my sincere condolences to the family, to the community, to everybody that knew this woman or anybody in healthcare. And anybody who's been personally affected by this heinous act. Violence, especially against women, has to stop. Visiting nurses want to help people. That's your job. Emergency medical personnel, doctors, law enforcement, even the store clerk and the gas station attendant down the road are being assaulted and killed just for trying to do their jobs. This past session, the legislature, these people behind me and many more, unanimously voted to develop a marketing campaign spearheaded by Senator Martin, which discourages aggressive or violent behavior towards any healthcare worker in the healthcare setting. That program is slated to begin in 2024. I say too little too late. Good intentions and kind words are no longer enough, and we must recommit to holding offenders accountable for their actions. Legislators, law enforcement, and the judicial system need to work together to implement strong, effective penalties for those who refuse to abide by the rules of our polite society. Violent offenders should not only be held, should be held until they have proven beyond a reasonable shadow of a doubt that they're able to rejoin our communities. If they choose to offend, then the penalty should be harsher. And in hearing today, we are sickened by this crime. We failed this woman, and we failed our system and our community. This isn't only a healthcare issue. It's a public safety issue. Our public is in danger with these issues. We need to find out how and why this individual only served 15 out of 17 years for their sentence, violated their probation, and went back to this halfway house. There are a lot of questions that are unanswered in this alleged crime. Hopefully we'll hear about those very soon. And moving forward, this legislator and everybody behind me will do what we can to make sure this never happens again. Thank you.
Thank you. Next is Next is Senator Henry Martin. Senator Henry Martin has worked very closely with the Public Health Committee on a bill to try and help take care of the concerns in the hospital settings of the healthcare system. So, Senator Martin.
Thank you, Senator Anwar. I got involved in this last summer when I was approached by Bristol Hospital regarding the violence and physical and verbal abuse that the ER healthcare workers were experiencing. And when you're in a room with 30 doctors and nurses and they're telling you their stories, I think you tend to listen. And what we were able to do this past session was shed some light onto the violence, physical and verbal abuse that has taken place within our hospitals, facilities, and all facilities that take care of us who expect to go to a healthcare facility to be healed, but yet some people, not only the healthcare providers, but patients and families who are visiting as well are experiencing this. First, let me just extend my condolences to the Grayson family. In addition to what we're hearing today about the visiting nurses, a broader net needs to be thrown out and looking at everything. And that includes the re-entry model that we have regarding those that are incarcerated, right? Why are we letting them out, particularly if they've committed a violent crime and they've been commuted, and you've heard about that this past session, but why were these individuals, or are these individuals, being let out sooner than they should be, particularly when it was a violent crime that they committed? So perhaps we need to look at those policies within each of if it's DOC or DSS or wherever those policies exist, that they are allowed or they've been given the authority to reduce the sentence. That I don't quite understand, but nonetheless, we need to look at this on more of a broad perspective. So thank you, Anwar, for putting this together, and I'm sure we're going to be working, both sides of the aisle will be working together on this. Thank you.
Thank you. Next is John Brady with AFT Connecticut. Thank you, John, for your leadership and representing the nurses and other healthcare workforce.
Thank you, Senator. I am the Vice President of AFT Connecticut, but first I'm a registered nurse. I want to thank everybody who greeted me and the other nurses and the healthcare workers when we came in with hugs. It's a small community, and this hurts. For me, it's become more personal because I found out when I saw the obituary that Joyce comes from a prominent family in the small town that I live in. Her family's been involved in public service for a long time. And thirdly, Joyce's daughter is also a registered nurse and one of our members. So my thoughts, my prayers are with them, but prayers aren't enough. As documented in the AFT Healthcare Staffing Shortage Task Force report, healthcare and social service workers experience more than 3/4 of all the reported workplace violence in the American labor force. And the number of actual incidences of workplace violence is likely much higher. One study of staff working in psychiatric hospitals found that 85% of those incidences go unreported. On a national level, the Workplace Violence Prevention and Healthcare for Healthcare and Social Service Workers Act, championed by Joe Courtney, has passed the House of Representatives twice. That bill would require OSHA to develop a standard for workplace violence. That bill needs to pass, and that bill needs to become law. But while we're working and advocating on a national level, we need to work on the state level and the local level too. Last year we showed how healthcare organizations like the AFT and the Connecticut Nurses Association can come together and collaborate with legislators from both parties and with representatives from state agencies to pass our meaningful, safe staffing legislation. We have recently been meeting with the Connecticut Nurses Association around workplace violence. and we commit to continuing that collaboration in an effort to pass meaningful state legislation on workplace violence and safety in healthcare. We will also strive for meaningful language in our collective bargaining agreements. I am not 100% sure what the answers are, but I know this: inaction is not a solution. Our healthcare workers and our patients deserve better. Thank you.
We have representatives of the Connecticut Nurses Association, and I would ask all of them to join us, Stephanie and Kim and everyone else here.
Good afternoon. My name is Stephanie McGuire, and I'm here today as a registered nurse and to speak on behalf of the Connecticut Nurses Association. I stand here today with our association's executive director, members, and the Connecticut Nurse Honor Guard, and with all nurses in the state to honor the nurse for her service. And of course, our heartfelt condolences go out to her family and loved ones and her colleagues. Nurses do indeed share a special bond, and we understand the commitment that she had to her patients, like we all share with our patients. This is not a new problem. Unfortunately, it's a national problem as well. Sadly, it's now here in Connecticut as well. I'd like to share a message, if I can, from the president of the American Nurses Association, Dr. Jennifer Menzik Kennedy. She wrote to us, "I and the American Nurses Association send our deepest and sincerest condolences to the family, loved ones, and patients who experienced the loss of this beloved nurse. They will have to endure a lifetime of unspeakable trauma, pain, grief, and heartache. I and my predecessors have been consistent in our calls to end workplace violence in healthcare. Regrettably, it's become a disturbing trend in headlines, but has absolutely no place in our profession. This is wholly unacceptable. Nurses in particular are dedicated and genuine in their work to help others and to ease their pain and suffering. The very least we can do as a society is to ensure they are protected, supported, and work in safe environments. They absolutely do not deserve to be assaulted or worse, killed. The Connecticut Nurses Association promises to stand firm on this nurse's behalf and with all nurses to move forward meaningful solutions to create safe workplace environments so that nurses and healthcare workers can safely provide care. The healthcare sector is an essential cornerstone of our society, dedicated to the care and well-being of all. It's a place where compassionate professionals commit themselves to healing, often working tirelessly to save lives. However, it's also a setting where we've witnessed that alarming rise in workplace violence, where 1 in 4 nurses have experienced it. We can no longer ignore the violence. It threatens the very essence of what healthcare stands for. And it puts our dedicated healthcare workers at unnecessary risk. We honor this nurse through her action, and we expect that there will be meaningful change in her honor. We call upon the state healthcare systems and healthcare colleagues to drive that change toward a safer and more compassionate healthcare system. On behalf of the Connecticut Nurses Association and all nurses in Connecticut and across the nation, we fully support this ongoing investigation into the death of our fellow nurse, and we keep her family and loved ones in our thoughts and prayers. Thank you.
Thank you. Before I ask the next speaker to come, I want to recognize some of my colleagues who are here. I wanted to recognize Senator Needleman, Senator Austin, Senator McCrory was here. We have multiple meetings going on right now. Senator Slapp, Senator Lesser, and Senator C.C. Marr, who was here, but she actually has to chair a meeting upstairs. And Representative Nolan, who was here, Representative Eckert is here, and Representative O'Day. I hope I didn't miss anybody. And thank you, everyone. And I wanted to have the next speaker, who is Tracy Wodat, with the Connecticut Association of Healthcare at Home.
Thank you, Senator Anwar, and all legislators who are here today, Lieutenant Governor Byswitz. So much has been said today. I must begin by extending heartfelt condolences to Joyce Grayson, her life well lived. Lieutenant Governor said that she is a hero, and she truly is. To be in a profession where she is caring for the most vulnerable, seriously mentally ill patients in the community, and to want to do that and to want to make a difference is truly a hero. To add that she fostered 35 children through the DCF system makes her a true hero through and through. She was born on this earth to serve out a mission to care for our most fragile population. She deserves so much more than what she got. It is tragic. Our heart goes out to the family, to her loved ones, and to her agency, Alara Caring. They are the #1 behavioral health agency in the state. They partner with our prison system. They partner with DEMIS. They do all they can to provide services appropriately in this community. They are devastated by this loss. Their nurses have a fear instilled in them that I don't know how it will get healed. We need help. We need protection. We need safety. It has always been a top priority, but it seems in this day and age, violence has taken a trend that is beyond our ability to keep up, to catch up, and we need to put the brakes on, and we need to be able to manage that. I am a nurse, and I've been a nurse for 40 years. I've been a home health nurse. I used to go into some pretty bad neighborhoods, but you know what I did? I was able to call the police, and I was able to say, would you please come with me on these visits, because I can't go into this housing unit on my own. They came, but you know what? That option isn't there nowadays. The staffing, the funding, they don't have extra time to come out and escort us on our visits. So Senator Anwar's comment about escorts is vital. Back in 2017, we had an add-on rate that was eliminated, and that add-on rate was specific for high-risk patients, high-risk communities, and the ability to provide an escort. We need to bring that back. I also want to address the medication administration visit that Senator Marks spoke of. Sometimes, yes, it's pretty straightforward, but many times the social determinants and the challenges, the serious persistent mental illness, schizophrenia, violent component, all of the pieces that you are seeing in the news about this particular alleged assailant is something that you can't, even if it's 5% of your job, we have to protect that. We can't keep thinking that it's just a med-admin visit. It is not just a med-admin visit. We are there to manage the behavioral health community and to keep them safe. We don't know where they are half the time. They live under bridges. They are in shelters. They are in halfway houses. They are in transitional homes from prisons. What are we missing? We're missing the security, but we're also missing good information. We have to address the discharge planning process, the referral process, the ability for us to collaborate across the systems, but collaborate truthfully, honestly, and not hold back some of the serious issues that our citizens face. If we don't know those issues, we can't mitigate that risk. So we must address that up front. Many of you may notice that I'm wearing a white ribbon, and many in the room are already wearing white ribbons. Our board today had an emergency meeting, and we decided we need something to show our solidarity. And our solidarity is through this white ribbon, which symbolizes, it's a universal symbol for faith and hope, but it also represents all frontline essential healthcare workers. Please, I have some ribbons with me, probably not enough for the entire room because we only had an hour to put these together, but please ask and I will happily provide those for you. Some of the things that I also hope will be looked at through legislation, and believe me, I will be very much at the table and a voice to help with any legislation. We need to bring back that add-on. We also need to recognize that in 2016, the year before the add-on was eliminated, our behavioral health visit rate was cut by 15%. We need to bring that back so that we can continue to care for this population. I talked about the improved communication and the disconnect on referral information. That has to be part of any legislation. And I would like to venture the opportunity to consider some type, they have a lot of security devices nowadays, some type of device that can be funded so that it's not just nurses, I've heard nurses all day, and God bless Joyce Grayson, a wonderful nurse, but it's all of home care community. So many people are in and out of homes that are put at risk. We need something to be able to push that button and get help immediately. We need training. We need training on self-defense. We need improved communications with our municipalities. Our staff are already asking, can we carry pepper spray? Can we carry tasers? We need something to protect ourselves. Now, believe me, it's not 100% of the population that we serve. Most are in safe situations, but we are at risk. We don't know what we face until we cross that threshold. Nobody knows how people live. They go into the walls of the hospitals, the nursing homes, etc. Nobody goes into their homes except for us. We know the true situation, and sometimes it's very scary. I am extremely worried about our already established workforce shortages, but I am even more worried about what's going to happen because of this tragic event. Our nurses are fearful. Our live-ins, our companions, our personal care aides, our therapists, our social workers, they are scared. We need to give them a safe environment. Again, our hearts go out to Joyce Grayson and the hero and the legacy that she is and will leave behind, for her family, for her friends, loved ones, to Alara Caring, and to the entire home care community. Please accept our sincerest condolences. Thank you.
I just want to recognize some of the other home health agencies that are here as well, which includes Hartford Health Home Care with Eric Smolin. Thank you for being here and the work that you do. And also Sasa Harriet, who is the CEO for Harriet Home Care. This home care agency is providing care to every gunshot victim in our state, essentially. And they are also providing care in some of the areas where people would feel uncomfortable going. We have been conversing about this for the past many months because her workforce is going in areas where they feel insecure. There's so many components to this that we have to address. So Sasa, thank you for the work that you and each one of your team members does for Harriet Home Care. Thank you for that. And with that, we will take any questions if anyone has any questions.
Just a quick question for Senator Marks. You talked about how for decades you've been calling for more protections. Why hasn't it happened? Was there someone on the other side fighting against it?
Yes, so there was a murder in New London, and there had been a lot of gang activity, I'm guessing like 15 years ago. And so we did get into our union contract that if you wanted an escort, you could get one. And so we did have an escort, which was awesome. Like, it really was great. And then it was a retired police officer that was our escort, and he moved. And then they just decided not to fund it anymore. I don't know, it's always money, isn't it? Yeah. And so, and you know, so I'm kind of the one that speaks up. I'm not afraid of management. And, you know, I'll be sitting at my desk and I'll hear a nurse say, you know, I went into this house and I just feel so uncomfortable. And then he liked me on Facebook and made some comments, and I don't want to go back there anymore. And then management will say, oh, well, just make sure there's nothing between you and the door so you can get out. And I will stand up, you know, from my desk and say, no, if you feel uncomfortable, you do not need to go back into that house. But then they'll just send a different nurse.
So now the idea is to make the state kind of mandate that these companies have safety.
Yeah, and you're shamed a lot if you, I mean, I could tell you story after story after story, but you are shamed a little bit if you say you feel unsafe going into a house. Like, oh God, now we're going to have to find a different nurse, and that's going to mess up everybody's caseload. And you know, now they're taking it seriously. We had an emergency meeting last night. They're dusting off the contract for the escort, and you know, we could use telehealth a lot more if. You know, if Joyce maybe even had somebody on a video, like on camera when she was going into that visit, would that have made a difference? I don't know. There has to be some kind of research out there and studies. We're not the only people that are worrying about this.
Do you know for sure that Joyce was going in by herself?
I don't know anything about the situation, and I'm not going to talk about. I didn't think I was going to say her name, but I'm glad people are saying her name. So yeah, I don't know.
Tracy, do you know what's going on? Do you know?
It's an ongoing investigation. There's no details on that.
We have the co-chair of Human Services Committee, Senator Lesser, because that also is the Medicaid payment component, so I wanted him to make a couple of comments too.
Thank you, Senator Anwar, and I'll just add my condolences to the Grayson family and my gratitude as well to our visiting nurse, Senator Marks, for her advocacy. Look, the huge transformation to home health has largely been led by Connecticut, not just as a regulator, but also as a payer. It's through our state's Medicaid program, and specifically the Home and Community-Based Services block grant that we have. And as a payer, we have to, I think, as Tracy mentioned, make sure that we have the funding in place to make sure that folks are safe out there. We have a responsibility for all state-provided or paid-for services to make sure that people are safe. And so I'm excited to work with the Public Health Committee, with my co-chair on the Human Services Committee, Representative Jillian Gilchrist, to make sure that our Medicaid rules ensure that folks are safe, including visiting nurses and anybody who goes in someone else's home. You know, I was thinking back, I had a conversation with another colleague of ours who was running for office for the first time. And I told her the first lesson of campaigning, which is never go into anybody's home. When you knock on their door, stay outside. You never know what happens when you go inside. And she's actually a healthcare provider. And she said, you know, I go into people's homes every day, so I'm used to this. And so I was just in awe of the danger that people place themselves in and day out. Today we're at a very sad moment where we're observing someone's, tragic murder. And really, I think it's really incumbent on us to make sure that all folks who place themselves in harm's way are protected to the best of our ability. So thank you, Senator.
Any other question from the media? Yes.
There were some comments about looking at the re-entry process, harsher penalties, and I wonder how others feel about that being corrected.
I think as soon as we have all the facts around this, it would be worthy to have a conversation. I think the committee chairs for that committee that has cognizance will be having those conversations. Thank you. All right. Thank you so much, everyone. Thank you.